Hi, I'm Valerie Martin. I am one of the infection preventionists with Advocate Aurora Health at Home. I'm going to be showing you how to properly don your PPE for going into COVID positive, patient under investigation homes, or those that screen positive when you're doing your pre-screening phone calls. So let's get started. So I'm going to go into my bin. My N95 mask is in here, as well as my full face shield. Prior to donning any PPE, I'm going to be performing hand hygiene. When I perform hand hygiene, I need to make sure to use enough hand sanitizer to cover the entire surface of my hands, making sure that the product evaporates, and this process should take about 20 seconds. Okay, so let's first start by putting our N95 masks on. When we put our N95 masks on, we need to make sure to lay the mask in our hand as such, with the straps dangling below. Then we place it over our face. Top strap first goes at the crown of your head. Bottom strap goes at the base of your ears at the crook of your neck. When you place your mask on, you need to make sure it fits nicely to your face. So that means forming the nose piece around your nose. And now we're going to do a seal test. To do a seal test, you need to blow forcefully out and have your fingers around your mask to check for any air leaks. So I'm going to go ahead and do it. I have no air leaks, so I have a good seal. Now I'm going to be placing my full face shield on. Alright, and so if you notice that your full face shield has any smudges or anything from your previous patient visit, it is acceptable to use an alcohol wipe to get the smudging away. And now I'm ready to go inside my patient's home and don the rest of my PPE and perform patient care. Alright, so I enter the house with my full face shield and my N95 mask. I have a workspace here that I'm going to put a barrier down after I perform hand hygiene. When you do your hand hygiene, make sure to scrub your hands for at least 20 seconds, covering the entire surface of your hands. Making sure that you have enough product on there to get the entire surface of your hands until the product evaporates. Alright, now that I have clean hands, I can go ahead and establish my clean workspace by placing down a barrier. Alright, so now I can start setting my items out on my field. I have a garbage bag, I've got my gloves, I've got my gown, and my disinfectant wipes. I also have my hand sanitizer for hand hygiene. Prior to donning my PPE, I'm going to perform hand hygiene again. Scrub for a minimum of 20 seconds, making sure to get the entire surface of your hand. Alright. So now we can open up our gowns. Okay. So when we place our gowns on, make sure to put your fingers through the thumb holes. Put the gown on over your head. Notice how there's ties. Make sure to fasten all the ties on the gown. As such. Now we can put our gloves on. When we're putting our gloves on, we need to make sure that the cuff of the glove goes over the cuff of the gown. I am now ready to perform patient care. After I perform patient care, I can come and remove my PPE when I am finished. Here's our garbage bag where we will dispose our PPE. We can dispose of our bags if we don't have any equipment to bring out. If we need to wipe down equipment, we will use our disinfectant wipes, and we will replace black into those plastic bags. When I remove my gown, I take my hands, I grab the front of my gown, and I break the gown away from my body, and then I roll the gown into itself, making sure not to contaminate myself with the gown. Your gloves will come off with the gown. Now I will perform hand hygiene. For a minimum of 20 seconds, making sure to cover the entire surface of your hands.